My name is Brad Zanitsky. I'm a C5-6 quadriplegic. I broke my neck in 1994 at a motor vehicle accident, and it was quite horrible injury. I mean, it was when I was first thing in the hospital. It was a devastating thing. 9 months, 12 months of kind of horrific rehab, but then after that I went back to school and did more rock climbing and manage a very chronic medical condition that has a lot of good days and bad days. I am currently using medical marijuana to deal with not just pain, but like muscle spasms, and it's kind of a cure-all for all the symptoms that come with quadriplegia. It does the bulk of them. So growing up as a very active teenager, didn't have any symptoms to deal with, didn't have any pain issues, was extremely fit. I was also grew up in kind of a straight edge family where we didn't drink, we didn't alcohol and drugs were kind of the same thing. They're all bad. That's what bad people do. And when I broke my neck, then it took a little while to realize, like, oh, wait a minute, that there are reasons for taking medications. There are reasons for not just getting away from pain and stuff like that, but it was really like controlling muscle spasms. Like the medications I was taking for muscle spasms would have side effects so severe that I couldn't have a glass of wine with dinner, because you would never risk. You put muscle relaxants and wine together, like, yeah, that's dangerous, right? But a little bit of weed and a little bit of wine go together, like, that's a nice way to end a day. There were so many pills and so many side effects that came with those that I thought, there must be something that's better than that. And it wasn't through doctors or anything. It was just through friends that were also going through rehab that were saying, hey, like a little bit of weed is a better choice for you, maybe. It was something that I could control the dosing better too, so I could just have a little bit of smoke here, wait for a little while, symptoms are still there, a little bit more, and it wasn't something like, oh, I have to clobber it with handfuls of pills every day. The idea of spending taxpayer money on regulating what people do with their own bodies is quite clearly absurd. Cannabis is really probably about the most benign ways you can treat those things. And using heavy-duty chemicals to deal with those things is like using a hammer to deal with a small problem. I mean, really, just a little bit of weed can just take the edge off something. But take a handful of pills every day, or just use it when you need it. When I realized that I wasn't going to take 15 prescriptions to deal with 10 or 15 symptoms, I realized that marijuana was going to be kind of my one catch-all drug for dealing with autonomic problems, pain problems, muscle problems. Like mostly pain and nerve pain and spasticity are probably the two major ones. And that's probably the most effective way to deal with those. To deal with those symptoms is hardcore medications or just a little bit of cannabis. It's a very reasonable thing to do. So there are days where I might just have enough spasms in like even in my arms or my back that I just can't get any work done. Being at a keyboard or mouse all day, like it's actually enough to prevent normal use of hands kind of thing, and I just need a few doses of cannabis or marijuana. Just a little bit of smoke is enough to 5 minutes of that. 5 minutes after taking a few big drags off a a pipe or something like that, then those subsides quite quickly. The one thing that really sucks about using marijuana for pain and spasticity is that there's no way I can get on a plane with it. I've gone to several different countries where it's just like now I have to try to get by without it, and those are that's a try wheeling on cobblestone in London with full spasm and no cannabis. That's a nightmare. From a professional standpoint, doctors only want to give you stuff that's been gone through approval and things like this and been studied, of course, that makes perfect sense, but no doctor has really given me a hard time about smoking marijuana. They know it's out there, they can endorse it, but they see it in their patients, they know it helps them. So I don't have any problem saying, yes, I use cannabis. There's no stigma attached to it anymore. There shouldn't be anyway. So I'm not addicted to marijuana, I'm addicted to not being in pain.